Arm lifts. Sit or stand. Start with your arms at your side. As you breathe in, bring your arms up from the side. As you breathe out, bring your arms back down. Repeat 10 times. Arm lifts help to increase chest wall movement and allow more air to enter the lungs. Neck stretches. Gently side bend your neck towards your right shoulder. Hold your neck there for 1 minute. Breathe in and out. After 1 minute, gently side bend your neck towards your other shoulder. Hold your neck there for 1 minute. Breathe in and out. For upper chest stretches, bring both arms up and over your head. Place the palms of the hand on the back of the head. Breathe in and out. Stay here for 1 to 2 minutes. Side stretches. Lift your right arm up. Bend the left side of your body towards the ground. Hold for 1 minute, breathing in and out. After 1 minute, lift up your left arm and bend the right side of your body towards the ground. Hold for 1 minute, breathing in and out. Cat-cow. Exhale and slowly round your head and torso forward. Inhale and slowly extend your head and torso. Repeat 10 times. Huff cough. Take a deep breath in and forcefully huff out a cough by making a huff sound. Do this whenever you feel mucus caught in your throat. Diaphragmatic breathing. Put one hand on your chest and one hand on your abdomen. Breathe in deeply through your nose. Allow your chest and abdomen to expand. Start exhaling by actively contracting your abdomen. At the end of expiration, continue to actively contract your abdomen. Repeat 10 times. Diaphragmatic breathing engages the diaphragm and minimizes overworking your other muscles. Breathing in through the nose encourages recruitment of your diaphragm and humidifies the air. The active abdominal contraction increases the abdominal pressure and puts that diaphragm in a more favorable position. Glossopharyngeal breathing. Take a short breath in, hold your breath. Take another breath in, hold it. Take a third breath in and hold it. Exhale completely. Repeat 10 times. Glossopharyngeal breathing can increase the amount of air that gets into your lungs. 3-second breath hold. Breathe in deeply. Hold your breath for 3 seconds. Exhale. Repeat 10 times. This allows oxygen to enter parts of the lung that may be blocked by mucus. Pursed lip breathing. Breathe in through your nose. Exhale through pursed lips or puckered lips. Do this during exercise or physical activity when oxygen saturations fall below 90%. Repeat until your oxygen saturation climbs back up above 90%. Pursed lip breathing slows down the flow of air out from your lungs and prevents the airway from collapsing or sticking together if there is mucus in the airway. Incentive spirometer. Breathing in, hold the ball up for 5 seconds. Repeat 10 times. If the setting is too easy, you may have to turn up the intensity. Some incentive spirometers have an expiratory setting where you blow out. If your incentive spirometer has this setting, use this setting as well. In this setting, you will blow out against the ball and hold the ball up for 5 seconds. Repeat 10 times. If this is too easy, you may have to turn up the setting. Walking. Walk 2 to 3 times a day. Start by putting on your pulse oximeter. Maintain an oxygen saturation of 90%. If your oxygen saturation falls below 90%, engage in pursed lip breathing until your oxygen saturation rises above 90. You can also use the Borg scale. Maintain a Borg level of exertion less than 4. That means you should be able to hold a conversation and breathe easily.
I think I can breathe easily.
If you are unable to hold a conversation with a Borg score above 4, rest and engage in pursed lip breathing. Continue like this until your oxygen saturation is above 90. If you have oxygen supplementation given to you by your doctor, use it while you walk. You can turn up your oxygen by 1 to 2 liters during activity to maintain saturations above 90%.